So I guess the topic at hand is the Affordable Care Act, Obamacare healthcare reform, and the House voted to repeal it. You voted to repeal it. Why?
Well, it was something on the campaign trail that I promised people I was going to do because, quite frankly, it's tying the hands of a lot of our business owners and not allowing them to go out and hire people because they don't know what's going to cost them down the road, and it's really killing jobs in a time where we really need to be creating jobs.
So this is something you heard on the hustings rather, because obviously the bill was, the philosophy was going to be a job creator, but even people, kind of just regular small business people on the street, realized that it was not.
No, and it wasn't. And in going down that process, I think as we sit here today, there's been 1,040 exemptions granted to it. Along with your whole Cornhusker kickback Louisiana purchase. If it was such a great piece of legislation, it would have passed with bipartisan support, and it didn't. And that's what we really have to move to. I think where they wanted to go with healthcare reform, yeah, we all agree on that. We agree. We have to address tort reform. We have to do purchasing across state lines. We have to do pooling. We have and people with pre-existing injuries and conditions need to be covered. We agree on that kind of stuff, but does it take thousands of pages to accomplish that? I don't think so. The thousands of pages are the ones that they did people favors to get them to sign on to it.
Now that that vote's been taken, what type of mail or calls or visits are you getting from folks in your district about this issue?
It's kind of went away a little bit. It's going to resurface, I think we just addressed the 1099 mandate, and really another tax, if you will, on small business, and on business in general, and it's really how they're trying to create a so-called tax to fund it, and that's not really the way we need to go about it. We need to bring the cost of it down. It can fund itself if it's done right.
We're getting a lot of comments from doctors who are saying that besides the money issues involved, it's taking power away from them. It's basically trying to tell doctors how to practice medicine, and could lead to price controls and choice controls.
Well, it ultimately will also, because there's so much unknown out there about it, and how many actual patients are each doctor going to have to handle on a daily basis. You're actually going to affect the efficiencies that they have, the attention to detail that a doctor really needs, the personal relationship a doctor needs to really diagnose, a injury or a sickness, to get it, fixed and solved for them. You need that relationship. You need time spent with them. And when there's more people involved that they can really handle, it's really hard to do.
I guess the government does lots of things well. Being a person's doctor isn't necessarily one of them.
Well, saying that the government does things well is questionable in and of itself, and then I think it's really time, and it's really what I think just happened with this whole mandate is really set back, and does government play a role, or what are the unintended consequences of every piece of legislation we've passed? What mandates are we putting on people?
Well, obviously, the biggest mandate that's out there in the news these days is the individual mandate to purchase insurance. A number of judges, including a judge in Florida, has ruled that unconstitutional. It's going to go to the Supreme Court sooner rather than later. Any views on that?
Well, and personally, I would like to see it go to the Supreme Court, but the Supreme Court really controls their own docket on what they want to hear. So that needs to be seen. But it's a decision that's going to be coming down the road, and we hope it happens soon. I know here in Congress we're going to do our best to. Because we're holding the purse that pays for all of this, and we're going to try to defund it as much as possible, and really try to get people to come with us so we can sit down and have this discussion and make it affordable for the American people and get the people the coverage they deserve.